the so-called government option for healthcare. But our next guest isn't so sure the AMA has really seen the light. We welcome back Catherine Sirks. She's from the Association of American Physicians and Surgeons. Catherine, thank you so much for coming back. I just want to reiterate here, we've got a New York Times report that the AMA now says it opposes any proposal for a government-run, government-led, government-managed insurance program. We think that they are backtracking. And you?
Well, not really backtracking. The key thing here is the individual mandate, and they have been very strongly on the record for a number of years, going back to votes in the House of Delegates, on the individual mandates and the mandated insurance. If we have mandated insurance, it's the slippery slope towards whatever mechanism is used, whether it's a public plan or whatever. But maybe they're playing a little bit hardball here. There's a couple of things that could be at work. I mean, they paid $10 million to come to the table, and maybe they're wondering what they bought for that $10 million.
Catherine, I have to insert one thing here. The New York Times is, the AMA is now putting out a report saying that they disagree, that parts of the New York Times reports are wrong, but they're not saying which parts. So my question is this. Is there a turnaround in the medical community? Is there the beginnings of it? Look, we're not so sure we like this government program.
Well, let's make it clear. There's the medical community, and then there's the AMA. The AMA is leadership, and then there's the medical community. Doctors are overwhelmingly, what we're hearing from doctors, that they're against it. They are not well represented by the AMA. Has been losing members like crazy. They've gone down 25% in their membership. So doctors are kind of coming to see the light. Maybe the AMA had a come to Jesus moment and realized that they weren't getting what they wanted. But just this morning, they sent out another alert talking about the SGR, which is the Medicare reimbursement rate. It's still all about the money with the AMA. And the bottom line is, as long as it's all about the money with the AMA, it's going to come out of somebody's pocket or be rationed care for patients. So the bottom line, as long as the AMA is squealing like a little stuck pig about money, patients are going to pay the price.
Now, Catherine, don't be nasty about your opponents within the medical business.
I'm being snarky, not nasty.
Okay, that's fair enough. We'll accept that. One quick last point. If indeed doctors are coming together to oppose this proposed government insurance plan, have you got the clout to beat it back and defeat it?
You know what? It's not about whether the doctors have the clout. It's whether their millions and millions of patients have the clout, and I think that they do.
No, Catherine, come on. We all know about lobbying. We know about clout within Congress. Can you get it together to oppose it and beat it?
Well, if the AMA spending $10 million in lobbying is not getting the deal that they want, I don't know what's going on here. Our doctors tell us that, again, it's not about money, it's about hassles. Well, hassles translates to hassles for patients. So I'm sorry, Stuart, I'm still going to come back and say that it's about patients and that the patients need to rally. Doctors can take the lead, certainly, and doctors should have the clout, because if doctors start peeling out of the system, then who's going to take care of the patients?
Catherine Sirks, we hear you, and we thank you very much for coming back to us again. Come and be a visitor again. Thanks.